back, friends. My name is Michael Yates. This is the Ridgeview Pod, where we try to cover everything hope, healing, and recovery related. My guest today, oh my goodness, Denette Jackson.
That's right.
All right, from UT Extension.
Nope, UT College of Nursing, but we do work with UT Extension too. So
All
they're
right,
on this
very
project
good.
as well.
Awesome. So we were just chatting before beginning to record. So tell me a little bit about your role as a navigator and the counties that you cover.
So I'm a Community Registered Nurse Navigator, and I'm in the East region. I have Anderson, Campbell, Claiborne, Morgan, Granger, Roane, Knox, Scott.
A lot.
I think that might be it. I think there might be one that I'm missing. But I have 9. I share Knox County with another nurse, so we kind of split that. I take the north side of I-40. And my role is to work within this project to find out barriers to routine vaccines. So not specifically COVID. There's a lot of teams working out on COVID, but we're talking about those vaccines for children like MMR, polio, varicella, rotavirus, and for the adult population, shingles, pneumonia, flu. HPV is in both of those categories. So just any routine vaccine, we want to find out what the barriers are and help folks be able to access those.
Yeah, so I love the word navigator. It comes up in a lot of different health services nowadays, even with substance use related stuff. So just tease out a little bit more. What is it about your navigation? Is it all linkage in education? Is that primarily what you're doing?
Yeah. So we have it's kind of 2 parts to this project. We're going to go in and assess the barriers first. We do that with interviews. We do that with surveys, talking to community leaders, talking to community people in the community. And then we go back and see what can we do in that specific county, even down to the zip code, to eliminate those barriers. So it can be education. It can be working with community partners. We find that people have a lot of other barriers like transportation, food, housing, and so substance misuse sometimes, and just linkage to medical care. So we see how can we work with community partners to meet both of our goals, including whoever it is we're helping. So I get to do cool stuff like volunteer with free medical clinic. I get to work with some senior centers and do Meals on Wheels. So navigation just means I kind of get the ability to see how do I connect these people to vaccines? What way do I need to do that?
Yeah.
And so I get the freedom.
And I'm a curious by nature, I think. And so I have been very curious about the drop-off in vaccination, just generally speaking. And I think you bring up a good point about it being, I think there's a tendency for people to immediately jump to associating it with a distrust in institutional recommendations, and that there are other factors like financial insecurity, transportation.
Correct.
I mean, on the hierarchy of needs, there are things that are probably a whole lot more important for that day and that time for families. And I think that's an important thing to bring out. You mentioned free medical clinic. So are you going to be part of the RAM, the remote area medical? I
will be out of town for that weekend, but Maria is the new nurse that's coming on in the East region. And so and I've worked with RAM. I worked with them at the Jacobs building. So for this project and before that. So I'm working with RAM, free medical clinic, and Maria, that'll be her very first event.
All
so
right.
If you see her out there, welcome her.
Yes.
She's going to be wonderful.
Yeah.
So she'll be there.
Well, when this publishes, the RAM clinic in Oak Ridge will probably be in the past.
Okay.
But we will, Ridgeview will also be there providing some resource information and navigation help to connect people with the who may need some behavioral health service or intervention. So how long have you been in this role?
I've only been in this role since May. I worked for Knox County Health Department before that, also doing vaccines for a year. So when this popped up, to be able to serve, that was only Knox County, to be able to serve not only Anderson County, which is my home county, but all of these more rural areas. I have a strong interest in making sure that folks who are rural get health care, that they live a long life, that our culture, our traditions are carried on. So I jumped at this opportunity.
Yeah, very cool. Well, welcome. So this is a new position.
It is.
Doing this in these counties. All right, that's very neat. Ridgeview will be introducing probably in May. We hope it will arrive then, our mobile health unit. So yeah, you may have heard a little bit about that. It'd be opportune for us to partner with you guys to make sure whatever information you think is relevant to have on that unit, we also disseminate, because several of those counties are counties that you also are serving. So, well, they're very neat. Are you also providing vaccinations, or do you direct them to like the health department or?
So in this role, previously I actually injected people with vaccines. In this role, that is not my primary. I haven't done it yet in this role, but I do offer myself up to health departments to help with like vaccine, back to school, flu, anything like that. I can do that. It's within my scope. Anything that's within my scope, I can do. So if that's needed, I can definitely do that. But trying to bring in partners like health department, we've brought in Clinton Drugs at the Anderson County Senior Center, just kind of navigating and taking care of the promotion or the education ahead of time before they get there. So they just come in and do what they do best, and then they move on to serve the rest of the county. Health departments are doing great. I mean, they are just working with very little, so they do great work.
Well, gosh, and for, several years there, the focus was all around testing, and then it shifted to vaccination and testing. So it's nice that, I know they're overburdened with work, but that, some of the focus can begin to shift back towards things like vaccination. So here's the public service tip we're going to give people, because I just asked you this before we started. I'm 58. We were talking about shingles. Knock on wood, I don't think I've had it. I guess I would know if I've had it.
I think you would know.
So should I get the shingles vaccination?
You can get the shingles vaccination.
Yes.
I would suggest you get the shingles vaccination.
Yes.
You want to talk to your primary care provider, make sure that that's appropriate for you. They will probably encourage you to get the shingles vaccine.
58, over 50. Yeah. Okay, good.
Yeah.
I need to, anything I can do to remain out of the hospital is a good thing.
And it can cause some long-lasting nerve damage, and you can get shingles more than once. It's a reactivation of that virus.
Okay.
So some people are like, oh, I've already had it. I don't need the vaccine. It can come back.
All right. So if I'm watching this and I think I need to learn more about what either my kids should be getting or what I should be getting, where can they link to? Is there a website? Should they call someone to get more information?
If you're in any of my counties, call me. You can directly call me. Email is great, djacks75@utk.edu. Unfortunately, I don't have my office phone number memorized, but
all right.
I can definitely put that in.
Yeah, we'll put it in the links when we share it on our social media stuff. So.
And we'll have a website up soon that will show you. It's hard to know what all you need, especially if you're not constantly going to the doctor like some of those parents are. You go 2 months, 4 months, 6 months, and they'll kind of let you know, here's what you need next, here's what you're lacking. When you get to be an adult, you don't have to go as often, so it's harder to know. We have flyers, so if you ever see me at anything, we have the flyers that kind of break it down for what can you get. But really talking to your physician, and sometimes you need to have that conversation.
Yeah.
Are there any vaccines that I'm missing? What vaccines can better protect me? And they can go through your specific history. If you have diabetes, high blood pressure, if you are a smoker, a substance abuse in the past or currently, there's a bunch of different vaccines that would be right for you and your specific medical history.
Okay, good. Danette, you must, I can only imagine what your mileage log for a week must look like.
Yeah, I average about 1,000 a month, about 1,000 miles a month.
So you either listen to music,
I do.
listen to books on tape, sing in the car, something, because that's a lot of time in the car.
It is.
So I'm always curious with our guests to inquire, because I think this is an important thing, especially for folks in the healthcare field. How do you take care of yourself? So tell our listeners a little bit about your own self-care. What do you do?
I kind of pretend like I'm the best friend to myself. So sometimes that looks like cleaning up the kitchen at night. So when I wake up in the morning, I'm like, wow, thank you, Denette, for doing that last night, making my bed. I think yoga is great. I know a lot of people are intimidated, but you can do yoga at home on YouTube, Yoga by Adrienne. She is gentle and wonderful, and she just makes you feel better about yourself, even if you're just basically laying on the floor. She's wonderful. So yeah, those kind of things. And then using the community, when you're feeling bad, reach out and get some lifted support.
Yeah, you make a couple of great points there, and I never really thought about it the way you first said it, and that is just being a good friend to yourself. That's I think a really neat way of putting it. And a common theme that's come up in this podcast with a number of guests has been the importance of social connectedness and people, reaching out, we're hardwired for connection with other people.
Absolutely.
And I know when people are feeling crummy, whether physically or emotionally, maybe they've been depressed for a while, that sounds very intimidating. Like, why do I want to get out and be with other people? But it can really be a good medicine for one's ability to optimize better mental health. So, yeah, good tips. If you don't mind, I also like to ask our guests just a couple of offbeat questions. Okay. I don't know if Kaylee prepped you for this or not. She did.
We'll see. She kind of did.
Yeah, it just allows our listeners a different way of hearing not just professional things about people, but so like your tips about how you take care of yourself is certainly a good one. If you could invite 3 people to dinner, living or deceased, non-family, who would you invite?
Non-family.
Yeah, because we don't want to split family,
My answer is always family with this. If I can invite 3 people, I'm not sure I'll have a good answer for this. It would probably be musicians. I love music. Probably Janis Joplin. Maybe, Prince for sure. And then I maybe throw in someone, I don't know, maybe Princess Di.
Yeah, okay.
We'll just make it a nice dinner party, a little mix.
Yeah, nice. We'll
do that.
My wife and I just finished watching the Meghan and Harry thing on Netflix, I guess. So were you a reader growing up?
I was, yeah.
Did you have a favorite childhood book or a favorite novel as a child that resonated with you?
This is going to sound so cliche. Sweet Valley High was like the book that I read. I frequented Clinton Library quite a bit. And so I would just pick books on whatever they had sitting out that looked good. So I read like lots of random books, but I never missed one of those. They were the silliest books, but I love them so much.
Cool,
so, yeah,
cool. Well, that's...
There are probably 100 in that series. They just followed 2 twin sisters and yeah.
Yeah. Well, do you still read today?
Not as much as I'd like to. I do listen to books occasionally on podcast or on Libby, but not as much as I'd like to.
Yeah, it's I'm not my wife is a voracious reader, and it seems like she can read 2 books at one time. I mean, she reads that much, and I really enjoy it, but I don't do it as much as because there are so many other distractions and other mediums of entertainment. But there is something special about a couple of those seminal books or stories that resonate with you long after those things are in the rear view.
I read A Gentleman in Moscow maybe like a year ago, and that book has stuck with me. It is such a good book. If you ever get a chance to read that.
A Gentleman
in Moscow. The writing is wonderful. The story's great. Really good book. So if you get some time, check that one out.
Well, you mentioned music. Do you have a favorite decade of music? Or what's the best decade of music?
I love all kinds of music. So, yeah, I would say, I grew up in the 80s and 90s, so that always is a soft spot. But even music that's coming out now, I love too. I can say I'm not super into classical music. I played in band, and I'm just, nah.
Yeah. Well, all right. Very good. Well, gosh, Denette, it's a pleasure to have you. Since this is really, since May, you said, by all means, feel free to come back anytime if we can be of help in getting the word out about the availability of this service. It sounds like you guys are doing a critically important thing, just helping the community, especially rural communities who are so underserved, receive information that can be important in their own discernment about helping their families be healthier. So thanks for the work that you're doing, and if we can ever help you again, please come back.
We are in the process of doing some health fairs in the next couple months, working with Family Justice Center, working with the City of Clinton. So I would love to let people know about this.
Yeah, fantastic.
Guys. Thanks for having me.
Absolutely. And thank you, friends, for tuning in. It's always a real honor when you've chosen to spend some of your time with us. Take good care of yourself, and we'll see you next time.